The initial diagnosis of epilepsy is based to a large extent on history, the detailed history of the incidents that led to suspicion of seizures in a patient, and some supporting evidence that we gather using brain imaging, specifically MRI, and a recording of your brain electrical activity, which is a test called EEG. In most instances, a patient is coming to a neurologist or an epileptologist with the possible diagnosis of epilepsy because they have had certain spells or witnessed convulsions which have led to the suspicion of seizures. So a careful history taken of those spells is very important because there are many conditions that can mimic seizures, and without being present at the time of the event to actually witness what happened, we have to rely upon both the patient and those around them to give us some information about what exactly transpired. Diagnostic studies that we do, specifically brain imaging and EEG, can only support that evidence. They don't make the diagnosis. So history, there has to be a history of events suspicious for seizures for us to make a diagnosis of epilepsy. In the initial diagnosis of epilepsy, these are about the main diagnostic studies we do. But in patients who fail to respond to medications, then we have to really establish the diagnosis of epilepsy, directly witness or capture their clinical spells, and determine that these are truly epileptic spells, because sometimes patients may have conditions that mimic seizures, which initially led to suspicion of seizures and treatment for possible epilepsy, but then later turn out to be not the case. So in those instances, we do certain other tests, specifically one called video EEG monitoring, where we bring the patient into a monitor setting and capture events to try to establish whether these are epileptic or not. In patients who are epileptic, who fail treatment with medication, there are a series of other diagnostic studies that we perform in order to determine if they are candidates for additional treatments such as epilepsy surgery.